In 2012 alone, uncompensated care costs incurred by Northfield Hospital and clinics amounted to $693,545. Health Finders Collaborative is an organization that offers clinical services, wellness programs, and reduced cost medication to the Rice County area. Through grants and in-kind donations from hospitals, Health Finders Collaborative is able to offer these services in order to reduce uncompensated care. Through our methods, we predict a positive return on investment on Rice County Hospital's in-kind donations. Throughout our analysis, we focus on a single stakeholder, Rice County Hospitals, and a single chronic condition, asthma. According to the Minnesota Department of Health, the total number of uninsured ED asthma visits in Rice County was 63 from 2009 to 2011. We multiplied this number by the average cost of an ED asthma visit, $3,733, to estimate the total cost of uncompensated asthma care burdened on Rice County hospitals.
When looking at the total number of uncompensated care patients in Rice County, one cannot assume that Health Finders is able to reach out to 100% of these patients. Thus, we indicate here the projected number of asthma patients that would receive treatment from Health Finders Collaborative. According to the Health Finders website, they treated 3,154 patients from 2009 to 2011. We interview a nurse from Health Finders who estimated that approximately 10 to 15% of Health Finders patients have an asthma-related condition. 12.5% is the average of these values and is the estimate that we base the rest of our analysis on. We multiplied these two pieces of data together to obtain the total number of asthma patients at Health Finders to be 394. We combine these observations to calculate a break-even point, where the cost of hospitals' in-kind donations equals the savings from fewer uncompensated care cases. For example, if the hospital in-kind donations equaled $1,000, then the break-even point would be where the hospital also saves $1,000 from fewer uncompensated care cases. We find that Northfield hospitals break even on their in-kind donations if Health Finders can decrease 7% of uncompensated asthma ED visits amongst their patients. In addition, our bottom line underestimates the benefits of Health Finders because they offer many other services in addition to asthma care. We multiply the total number of asthma patients by the estimated amount of reduced asthma ED visits. Then we multiply this number by the average cost of an ED visit in order to come up with the total cost averted by Health Finders. With a 7% reduction in ED visits, the hospital's in-kind donations to Health Finders equals the uncompensated care savings. The return on investment is 0%. As long as Health Finders reduces ED visits by over 7%, the hospital will incur a positive return on investment.
In addition, we looked to previous literature, and according to a 2006 study from Peter Hoke in the Journal of Asthma, the provision of free or reduced cost inhalers to low-income individuals decreased the number of ED visits for asthma by 62.5%. This number is far greater than the 7% reduction used in our break-even analysis. This study took place over a 5-year time span in Virginia at the Johnson Health Center, making it a strong longitudinal study. The Johnson Health Center's mission, the organization that provided the free or reduced care, is very comparable to that of Health Finders Collaborative. Using the same methods as before, and our new value of 62.5% from the study, we calculate an 869% return on investment on in-kind donations. In order to check the robustness of our findings, we calculate an additional estimate of a 20% reduction in asthma ED visits. Using the aforementioned methods, we estimate the hospital's return on investment to be 207%. Thus, a $1 increase in in-kind donations to Health Finders saves the hospital $2.07. Conservative in relation to the Hoke study, yet greater than our break-even value of 7%, a 20% decrease in uncompensated asthma ED visits demonstrates that Rice County Hospital's in-kind donations are indeed cost-saving. Therefore, it's in the best interest of our stakeholder, Rice County Hospitals, to continue to support Health Finders through in-kind donations. Thanks for watching our video.